Welcome to The Doctor's Daughter. I'm Kim Lynch, a doctor's daughter turned public health researcher and healthcare entrepreneur, helping clinicians get paid fairly and patients get better care.
And I'm Dr. Dan Roach, a physician informaticist, a father of twin daughters, and a healthcare technologist on a mission to make healthcare work better.
Where we're demystifying healthcare, one bite-sized story at a time. Did you know that while 2 in 3 patients feel afraid to speak up during medical visits, 91% of doctors actually want more patient questions and engagement?
I didn't know the stats on that, but I'm not surprised one bit.
Let's bridge that gap on this episode of The Doctor's Daughter. Before we get started, a little tradition we're trying here at The Doctor's Daughter. Let's start off by sharing a win of the week before we get into today's topic. Dan, why don't you go first?
My twin daughters, as I mentioned, they were home from college recently. And instead of saying, "What's for dinner?" or "What are you making?" they each individually on 2 different nights cooked me a wonderful meal. And that was a big win for me.
10 out of 10. That is amazing parenting. As someone who does not have that experience with my children right now, that gives me some hope to the future.
Yeah, it did take a while to get there, but we got there.
That's awesome. And for me, my win of the week, I asked for help. And that is not the easiest thing for me. But I was working on something. Thank you. I was working on something really hard, and I have an amazing friend who will often nudge me to ask for help, and I did. And she was amazing, has totally helped me clarify things. But it's those little moments of discomfort that I so identify with. I have 3 kiddos, and all of them will describe, discomfort of asking for help or as you're learning something new. And so I had that little moment of being proud of myself of okay, I asked for help.
That's awesome. Good for you.
I know it's a pretty common feeling to feel lost in a doctor's office or afraid to speak up.
I mean, that's exactly right. I mean, it's an intimidating situation, right? You have this weird dynamic between a person in authority position and a person who is in a vulnerable position. And so it's an awful, difficult dynamic. So something I've always taught my daughters is to remember that they are the most important person in that room when they're seeing their physician or any other healthcare provider, learning them to take ownership or teaching them to take ownership of their healthcare. And even as teenagers, something as simple as teaching them how to refill their own prescriptions and pick them up. And that helped them when they went to college. So now they can do that when they're away from home. And so just, learning that, it's okay to ask questions. It's okay to take ownership of your own healthcare, and you should.
And it's okay to feel intimidated. I know that I have felt that myself. And so, right,
as have I.
That's so good to hear, right? I mean, even a doctor can feel that way.
Yes.
I know how common that feeling is. And what I also know is what most doctors want, what most providers want, is for you to speak up. And why and how, that's exactly what we're going to break down on this episode. The 3 pillars that we have really talked about, first and foremost, trusting your instincts. Exactly like you said to your daughter, Dan, you are the expert in you. Yes. That's what my dad taught me as the daughter of a doctor, from a very young age, going into the pediatrician all the way forward. You are the expert on you. And that's your role, right? In showing up into any care situation, your role is to come in being the expert on you and what's going on. And then you've got your doctors, your nurses, your other care team members to help you. And you're all on the same side.
Right. Yes.
Of solving that case, right? That's how I was taught it's supposed to be.
Yeah. And, healthcare providers are human and they don't always remember everything from visit to visit. Right. So showing up and reminding them of something, that's okay. And they appreciate that. Right. It feels like you're actually taking some, not some ownership, but actually just being part of the care team. You have to remember you are the most important part of your own care team.
And that feeling of, am I feeling on my care team? Am I feeling good on my care team?
Right.
That's how it's supposed to feel.
That's right.
If something feels off, your voice is the one that's going to notice first. You're going to be the one who can send off that alarm. All right, Point 2. So trust your instincts. Point 2, you led right into it. Document everything. If it matters to you, write it down. And I would
Right.
love to hear your advice, because I'm sure you get asked all the time, Dan, for how do you recommend that? Because documenting everything can feel intimidating too. Everything? What do you mean everything?
Yeah.
Where do you start? I mean, I start with what's most important to me.
Yeah. I mean, I think it's just thinking of your a visit to your healthcare provider. Think, a doctor's office visit. Think of it as a business meeting, right? Take an
Mm-hmm.
agenda. And that agenda could be a list of questions, a list of symptoms, a list of concerns, and just having something written down so that when you get into this intimidating environment or vulnerable environment, you don't have to remember. You can just look on the sheet of paper you brought, ask your questions.
10 out of
It's just
10.
it's as simple as that.
I mean, I'm looking at my desk and I have a little post-it here with 3 bullets written down, and they're not healthcare related, rest assured.
Yeah.
No, no
Yeah.
healthcare information being divulged. But that is such a good point, because I can very easily get caught up in the first point that I'm making, or the first thing I wanted to talk about, and forget about the second
Sure.
or the third thing. But if I write it down, I'm not going to forget. I'm going to have my little post-it, I'm going to have my note. And I mean, honestly, I keep things like that for medical appointments on my phone, so that I know I'm going to have my phone with me and I can just
Hmm.
open up my notes app, jot down
Definitely.
what's important to me. I love how simple, but how powerful that can be, because I'm incredibly prone to forgetting. And another stat that I saw is that most patients get about 11 seconds in before they're interrupted by their clinician. And
Yeah.
so it's so easy to just end up, taking
Yeah.
point one and never getting back to points two and
Never
three on
get
that
back to
list.
point two. Yeah, that's
Yeah.
right. Yeah.
Ugh. All right. And the last thing on our list, and I'm so curious to get your thoughts on this as well, is to bring support when needed. So when you and I were first talking about this, I think the first words out of your mouth were like, yes, you need an advocate. And I was like,
Hmm.
wow,
Yeah.
because that wasn't something that I experienced when I was growing up. I was taught, like, this is your role.
Yeah.
It's certainly something now, and having had 3 children, I undeniably see the value in
Right.
having an advocate, having someone there with you, especially when something big is going on with you, like, say, a
Right.
pregnancy or a significant healthcare event.
Right.
Having someone who is another set of ears, who can also help advocate for you, is invaluable.
Yes, it is. I mean, it's just, and it could be anyone, right? It could be a spouse, a significant other, an adult child, a
Mm-hmm.
good friend, someone, but you want to, think of someone that could be a trusted companion, but is also a good listener and assertive, so that they are not afraid to ask questions that you've forgotten to ask, or they can help manage your list, and hear things and write them down so that when you leave the office, you have something to refer back to. So all of those things are very important. And as you say, especially during a kind of a big event like a pregnancy, or you're being treated for cancer or a chronic disease, or anything where there may be even some emotion involved.
Yeah.
Because we are all human, and when we get emotional or anxious, it's hard to remember things 10 minutes later, much less
Oh my gosh,
three
yes.
days later. Yeah. Right.
I'm thinking about exactly what you're saying. I'm like, yeah, my ears, it's like they
Yeah.
turn off in part. Another thing that we were talking about as we were thinking about this episode, I know some folks have asked their clinicians, and have gotten yeses sometimes, to record portions of a conversation, to say, as you're giving me these instructions,
Right.
do you mind if I record? And of course, everyone's got to agree to
Right. Of
record.
course. Yeah.
But I think, again, it's such a smart point, especially when you're getting complex instructions. I know they're going to be written down, but being able to slow
Mhm.
down and ask questions and say, I'm not sure I understood that. Could you say that a different way and make sure I understand it, or let me say back to you what I heard?
Right. That's
So much easier when you have somebody else there with you too, because, like you said, emotions go up, and I hear maybe half, probably
mhm.
less,
Well,
what's
and I
actually
think your
being said.
point of us, saying, let me to tell you what I heard, to make sure, that is so incredibly powerful and important, because oftentimes we hear something and it's not at all what was meant, and especially in those kinds of moments. So being able to establish that effective communication. And yeah, just take a minute, right? Let's just stop, pause, let me say it back. If I got it wrong, tell me in a different way so I can get it right. And I think that's, yeah, very important. So I'm glad you mentioned that.
Oh man, I mean, and again, it's a small thing, but it has a huge impact. So
It
let's
does.
let's actually give folks a taste of what this feels like. And bear with us, Dan and I are not actors, but we're going to do a little role play of first what a typical visit can feel like, and is the not ideal situation. And then we'll follow up, with a better version. So bear with us. We're going to open the scene. We'll call it the speed dating doctor visit.
So based on your symptoms and my physical exam, I think your low back pain is just most likely muscular. So I'm going to prescribe an anti-inflammatory, muscle relaxant. See you back in a couple of weeks. Any questions?
Um, no?
Okay. See you in 2 weeks.
Yikes.
Yeah.
That happens all the time. My friends that I talk to, they call that conveyor belt medicine all the time.
Mhm.
All right, let's try this again. So
Okay.
let's look at what this could look like instead.
So based on my physical exam and what you've told me, I do think your low back pain is most likely muscular. So we can just try a round of an anti-inflammatory and a muscle relaxant for a couple of weeks. If you don't get any better, then maybe we'll see you back and do some imaging, maybe think about physical therapy, but let's not get ahead of ourselves. Let's just take a conservative approach and start with this round of medication. Yeah, do you have any questions for me?
Yeah, I've got a couple of questions, and I wrote down one of them, which is how will this work with my other medications? I've got, some allergy medication I take, and I just want to make sure that that's
Mhm.
okay. And then
Oh,
I want to understand the differences between what you said of those two different medications. I'm not sure I understand those differences. Can we go back over those?
absolutely. That's a great question. I tell you what, let me pull up a list of all of your medications, make sure it's complete, and we'll kind of talk through each one and talk about how they might react with each other or not react with each other and make sure it's all good. And I'll go back through and even write down for you which of the two medications is which and when you should take them and things might be to consider. Because, for example, the muscle relaxant might make you a little sleepy, so you might want to take it at night. But we'll go through all of that, and I can write anything down that would be helpful to you.
Okay, that sounds good.
Okay.
It can be that simple. It can really
Yeah.
be that simple, but that
Okay.
slowing down. And I know that I have certainly felt a provider being rushed with me.
Yeah. Oh, we all
And
have. Yeah.
right, we've all felt that feeling. And I will say, I I reground, right? Like if I need something, like you said, treat it like a
Hmm.
business meeting. I'm going to think back to my pregnancies because 3 pregnancies, there was a decent amount of time in offices for
Yes.
those. And
Yeah.
I would absolutely do that pause and say, I want to make sure I understand the next steps,
Mhm.
especially first pregnancy and process, um, especially if you're going to a new facility for treatment, understanding
Right.
how you'll be picking up medications, how do I schedule my next
Hmm.
appointment, any of those kinds of process questions too. Um, Slowing it down,
Yeah.
asking questions,
Well,
it
and I
makes
think
such a
what
huge difference.
I think that's I'm glad you brought up going to like a different facility because that's something you can plan in advance, right? Look up where the location is, maybe even drive there. What you don't want to do is show up and not know where to go, get flustered and frustrated, and then you're late for an appointment or you're on time, but you're still flustered and then you forget everything. So just some careful planning ahead for the process part of it could help a lot.
I mean, no joke, Dan, I have absolutely selected providers, especially for pregnancy, based upon easier process.
Yes.
And where can I, have easy parking? Where can I take a little walk if they're running behind, right? Like
Hmm.
those kinds of logistics, you're right. Oftentimes you can know ahead of time and make a plan. And
Right.
like you're saying, then
Yeah.
you're not feeling rushed. And that whole making a plan, it helps me feel like I got what I hoped for out of that
Right.
interaction, right?
Right.
Whether it's a dental visit or, a medical visit,
Yeah.
right? Like
Anything.
all
Yeah.
anytime. Anytime.
Yeah.
I love that. I feel like this business metaphor, we're gonna stretch it one bit further. Like you are the CEO of your health. You can't
Oh, yes.
have somebody else do that for you, right? This is
Right.
really about you And a metaphor, because I love a metaphor that Dan and I were talking about with this, is like having a rudder. That if you know
Mhm.
what you are hoping to get out of a visit, it's like having a rudder in a boat. You know what you're hoping to get out, you know what
Definitely.
you would like um, your questions answered about, or what you're
Mhm.
hoping for next. That list can help you make sure that your rudder, you navigate that conversation to where you want it to
That's right.
go, as opposed to just showing up and being sort of tossed about by the waves and the wind of,
Right.
that particular day in that particular office for that particular provider. It really is about a balanced conversation. And back to
Mhm.
what you said at the beginning, Dan, seeing yourself as the essential,
Right.
center point of that care team.
That's right. That care team doesn't exist without you.
Well, there it
Yeah.
is. Ready to find your voice? We hope you are. With that, we've got you covered with some resources. We've got a visit prep checklist that we'll share in our episode notes, as well as some conversation starters and even some support person tips. Because, like Dan said, anyone you trust can be an advocate. I know folks that have turned to neighbors and support each other as neighbors in their community. I think that is an amazing source of supporting one another.
Let us know in the comments where you would like us to dig in more deeply or what our next topic should be.
Thanks so much for joining us on this episode of The Doctor's Daughter.